Hi, we're back to Healthy Living with Dr. Pelto, and we're going to answer a question that I get from people every summer when they go to the pools and when they go to the beaches, and they actually use this for treatment. It's duct tape. Can you guess what it is? It's how to deal with plantar warts. Plantar warts are warts on the foot, and the question I get is, why do I get warts on my feet, and how can I treat them? To understand about warts, let's look at a picture of a wart. You can see here on the skin, there's these little black dots. And these black dots are actually the blood vessels that feed the wart. And the whole goal is to develop an immune response against the wart. What is a wart? A wart is actually a virus, very similar to a flu. And if you have the flu, can you take medicine to get rid of it? Not usually. You have to let your body defeat the virus over time. And that's the same thing with a virus in your foot that's called a wart. Now, a wart is just happy to live forever in the top portion of the skin. It can live there for months, it can live there for years. Sometimes it goes away on its own, but sometimes it gets bigger and causes pain. Now, you have to be aware though, do you have a wart or do you only have a callus? In this other picture, you can actually see what a callus looks like. And these are two different types of callus. There's one that's very broad and large, and there's one that's very small. And both of these can be painful when you walk. And people, many times, they come into the office and they think, well, do I have a wart or is it only a callus? The easiest way to tell is to trim off with a razor blade the top of the skin, and if there's little areas of pinpoint bleeding, you most likely have a wart. If you don't, it's a callus. Another thing that you can look at is the skin lines. If you look at the skin, normally the skin has lines that go through a callus, but the lines don't usually go through a wart. So what are the treatments? One of the treatments that you could try at home would be duct tape. Some people think they can tape a penny to the bottom of the foot. Some people use acid treatments. They use freezing sprays. They use everything that you can find over the counter. But I want you to be careful, especially if you have diabetes or if you have poor blood flow. Because if you have one of these two things and you're going to use these acid treatments, every time you use an acid treatment on the foot, it's going to slough away one layer of skin. And it's going to make it really white and really, we call it macerated, which is just a damp. Kind of reminds me of dishpan hands. So if it gets really damp, that's going to cause a cut in the skin and it could become a problem to you. Be aware if you're using the acid treatment, don't use it every single day. You want to stop a little bit. What happens if you decide you want to come into the doctor's office? There are some advanced treatments, and I find that the two most effective, in my hands, are either removing the wart or using laser therapy on the wart. Well, how do you make the difference if you have it removed or if you use the laser therapy? If you're going to remove the wart, it's usually because there's only one or two that are very small that you can remove them in the office. Some people we have to actually take to the operating room to remove a big portion of the warts in the operating room. Now, how about the laser? The laser, remember the other picture I showed you before of the little black dots? Well, those black dots are actually blood vessels. And what the laser does is it actually shoots laser and heat at the blood vessels and causes them to coagulate and become kind of like charred blood, and they develop a scab. When you come back to the office a few weeks later, that scab can be popped out and a good portion of the skin is replaced, and you see that a portion of the wart is destroyed, and usually you have to do that a few types of treatments. Are there other topical treatments, for example, for children that don't want it removed, or other people that are just scared of the laser? There are some other treatments. A wart is a wart. So if you have another type of treatment, you could use something called Aldera or Carac. These are just technical terms for other types of topical treatments. They're not really as effective, but they can help people. And how about to prevent warts? Let's say you've had warts in the past and you don't want to get them back. Or let's say you don't want to get warts. Where do most of the people get their warts from? The most common place is actually the pool. Because in the pool, people are barefoot, they're walking around, they get little cuts in their skin, and that little cut can cause a viral infection from a wart. So be careful. Wear flip-flops when you go into public restrooms and public showers and also to the pool, because it can be contagious. So there are some treatments for treating warts. If you look on the internet, there's probably thousands of treatments that they're talking about. And you know why there's thousands? Because there's not one that really works well. So if you'd like to learn more about the laser treatment and the other treatments, you can go to our website at drpelto.com, and there's a portion on there that talks about how to treat warts. Thank you.